Mike, what is a congestive heart? You know, you admit somebody to the hospital with a cardiac arrest. What does that cost? What does that really cost? Not what you get paid, but what does that really cost? Easily $30,000. $30,000. Again, those of you who are employers know. What's he got? He's got physicians. He's got enormous expenses in terms of operating, you know, the capital, you know, running that operating room, the regulatory, the insurance. Oh, by the way, a little thing called malpractice.
Yeah.
Okay, a number of things. So I guess that's my 2 minutes. That's enough. I got more, but I better take questions, right? Before you pick me up.
Okay, so we're going to take a few questions for Dick, and if we're good, we'll be able to open it up, really vent and ask questions.
Hi, this is kind of a general question for the whole group. I guess I'm older than I look, or at least I hope I look younger than I am, but the point is, I remember when I was a kid, the doctor driving out to my house in a big black Buick. My sister, who's 3 years older than me, and also much younger than she is, actually was born on the doctor's nickel. My father, rest his soul, wouldn't be bothered by me telling you that he couldn't afford to pay. The doctor said, pay when you can. Now we've come a long way in 50 years, or 60 years. We've come from a place where it was a system that didn't involve huge insurance, huge government. We didn't have the technology we have today, but you know, let's throw a few bucks towards technology. My point is this: why do we even go from the premise that we need to first of all have government involvement, and why do we have to have a situation where people are being driven under financially because of insurance? I mean, can we do tort reform? Can we do any kind of insurance reform? Can we just keep government out of it? Can we just get back to, I know I'm dreaming. Is it possible to go back? Does anybody have a solution that would address these issues without getting deeper, which is what we're doing? Thank you.
You know, I'll take a quick crack at that. I actually like my co-panelists, but you're dealing with, it's almost night and day, okay? You're dealing with decision-making and rational and planning ahead and fiscal responsibility and personal responsibility that, frankly, most of you, looking out in this audience, most of your generation grew up with, okay? You know, the mainstream, all the generations, okay, sadly, they don't share, many don't share your same level of personal commitment to making those kinds of personal decisions. Okay? I just said earlier that the employer pays the lion's share of the health care premium. You don't see what the employer pays unless you read your check carefully. Okay? And so you don't really know, unless you are personally involved, you don't really know what you're paying for. You know what you're getting, and you care about that, and you want a decision. But I trust me, the average 30-year-old, which is, by the way, is the bulk of the coming, paying in workforce, they don't spend the time on it. Unless they're savvy enough to realize that they really do pay that, because that employer's contribution takes away from that employer's ability to pay a higher wage level. And in fact, if you look at the data, the last 10 years, the wage increases have been eaten up by that. They've been eaten, they're entirely eaten up by that. That's my answer.
We met. I'm Megan Cromwell from the North Bay Patriots, full disclosure. Can you actually inform everybody about what the actual numbers of the uninsured are? You explained it at our meeting, and we keep hearing 40 to 50 million, but that's not the real number.
Well, I guess it depends a little bit, but yeah, give me a second, I guess. You lose your job, there's a good chance you're going to understanding that there's no money to pay your premium. But these figures were done in 2007. But again, has that much changed? Obviously, we have more out of work, so we have more uninsured. Okay? So let me talk about this a little bit. And by the way, my source is the U.S. Census. Everybody knows how the census works. It's a sampling survey procedure. And are the recipients' answers to the questions always honest? No. All right. So with that said, using a baseline in 07 of 45.7. 7.2 million are 400% of the poverty level or above. That's 88 in round figures, 80, well north of 80,000 a year in income. So the argument there, I think Victor said it. The argument there is if you're making at least that much, can you put aside something for insurance? 12 million of the uninsured are eligible, as I believe Mike pointed out, whether they're children, the state's Medi-Cal program, not just in California, but the safety net. The minute that you check into the hospital, the minute you do that. 10 million are immigrants, and that breaks down to documented and undocumented aliens. Okay, 5.6 million was the estimate of the undocumented. Now, think about it for a minute. I'm being asked to pay for this. Do I get a say, and who I pay for? 40% of the uninsured are aged 18 to 34. 40%. So that number, just doing some quick math, is what? About 16 million. So to Victor's point, hey, I'm 25, I'm invincible. I could spend $300 or $400 a month on my insurance, but I'd rather spend it in the bar or for the car or whatever I want to do.